First, though, Princess Kate has been notably absent, of course, since the back end of last year after announcing in March that she was going through preventative chemotherapy for cancer, which was discovered during medical tests. She's now announced she's going to return to public duty tomorrow, but admitted that she has good days and bad days, which can leave her feeling weak and tired. So, how will the Princess be affected by her ongoing treatment? We now welcome world-leading physician, Dr. Karol Sikora. Good evening, Karol. Great to see you. First of all, your response to this long-awaited news that she will be back in the public eye tomorrow.
It's great news. It really is, because it means that she's well enough to appear and there are no problems. She's having what she calls preventive therapy, preventive chemotherapy, to prevent the recurrence of the disease. We've been asked not to speculate about what the type of cancer she has is, so we won't do that. But there's no doubt that she's doing well. She's tolerating the treatment. Treatment takes a lot out of you, as we've heard in the last 15 minutes. It really does. And it's enormously variable. You get good days, you get bad days, you feel sick, you feel tired. The worst thing is the tiredness. But I'm sure tomorrow it's a great, exciting day. The Trooping of the Colour, fantastic. She'll be there. She'll look great. I can guarantee it. I'm
sure. And, you know, we're all looking forward. Like I say, you don't realise what an important part of the royal family she is until she isn't in the pictures that we all see. We spoke to some of the public earlier and they were saying we just can't wait to even see what she's wearing. It just feels like a return, hopefully, to some sort of normality. But the palace have been at pains to point out this is not her returning to work, is it? This is an occasion that she wants to attend.
It's a special occasion tomorrow, and she's still going to feel not that great until it's all over, and then it'll take another month to recover when all the drugs go out of the body, all the side effects go. We're great at treating side effects now. We've heard about the anti-sickness medication. It's really much better than when I began as an oncologist a long time ago. But the problem is still you feel this dreadful tiredness, and also you're worried, the uncertainty of what's going to happen next. That's the problem all cancer patients face. The good thing that comes out of this is that people with cancer understand that even royals get cancer. With the king, the princess, it means that they feel, well, maybe it's not so bad. And more than 50% of cancer patients are cured of their disease, and it's increasing every year. So much greater hope. So she's doing the right thing for cancer patients around the world, because everyone's watching, not just here, everywhere around the world.
And she does talk about the fact that when she said, as I was just saying there to Emma Campbell, that when she's well, she said, I'm making good progress. But as anyone going through chemotherapy will know, there are good days and bad days. What's your advice as a doctor to cancer survivors, patients, when they're having a bad day? What's the best thing that they can do?
Let your body teach you what to do. Your body's very wise. If you feel tired, that means you should lie down. Watch daytime TV, read magazines, do nothing, go to sleep, whatever you want to do. Don't push it. It's enormously variable. So I've had patients that go jogging after they've had a shot of chemotherapy. It's amazing. Go jogging around Regent's Park. This is crazy, you'd think. But that's their way of handling it. Then they go back, have a beer or something and lie down. It's up to individuals. It's a very individual thing. And I think she's doing it her own way. And all cancer patients do that. And nothing to be afraid going to bed.
She does say in the statement, actually, she said, I'm learning how to be patient, especially with uncertainty, taking each day as it comes, listening to my body and allowing myself to take this much needed time to heal. When you are a busy working mother, which is what she is, that's not easy, though, is it? She was, you only have to look at her to know that she ran, was very fit and healthy, is not overweight, lives a healthy life, and obviously kind of probably runs on fumes most days anyway, like a lot of working mums do. So she won't find it easy, will she, to slow down?
No, and she's very young to have cancer. The average age is much older than her. It is increasing in young people. It's a very worrying feature over the last 20 years. It's increased in young people, all sorts of cancers. The problem for her, of course, she's got a family, she's got a lifestyle that's very demanding. And the biggest problem cancer patients have, I find, is living with uncertainty. They don't know what's going to happen next, and they're waiting for the next scan to see if they're doing well and so on. And this is tremendously psychologically pressurizing for them. So, the most important thing is to have people that care for you around you, people you can talk to, and she certainly has that, and it's great to see.
We've seen the Prince of Wales sort of be asked by members of the public when he's been making appearances that it's members of the public, it's the little old ladies who've been brave enough to ask him, how is Kate, dear? And that's all we've heard is he said, she's doing fine, thank you, she's getting better, etc. But in your experience, when you've got a young couple like that with a young family, what kind of toll does it take on the partner?
It's quite considerable, there's no doubt, because everyone's asking. You don't have to be a royal to have the same problem. People are going to ask, your friends, your school kids, children are going to ask what's going on. And it's always very difficult in a family structure to know what information to give to whom. And I think, the royals have handled it very well, both the king and the princess. They've handled the public relations component very well. They don't want to tell everything, but they're telling the majority of it. And I think in that way, you bring cancer out into the open. 50 years ago, when I first qualified as a doctor, you wouldn't even tell people you had. You would certainly not tell that the king has got cancer or the princess has got cancer. That's all changed. We're all open. And, when George V had cancer, no one knew. He had lung cancer and died of lung cancer, and no one knew he had it. And he had the operation in Buckingham Palace rather than at the Brompton Hospital. The doctors came to him, to the palace, to do the operation. Amazing change over the last, 80 years, basically.
Queen Camilla said the other day, didn't she, that the king doesn't always do as he's told, she said, when she's asking him to slow down. I quite like that, because I imagine, I don't know in your experience, but a positive mindset and feeling purposeful must inevitably have an impact on recovery.
Well, I think psychologically it certainly does, just doing your own thing, going your own way, doing what you want to do, doing as much, like the guy going jogging after chemotherapy.
Yeah.
How can you stop it? It's fantastic.
And also the children, just one last word really on the children. As Emma Campbell was saying there, it's very difficult to know what to say in these situations, isn't it, to children, because the assumption might be, oh, well, mummy's going back to work, we're going to be back at the event, we're going to be at granddad's house, and, this is mummy going back into the public eye, then she must be fine. How do they moderate the messaging to the kids?
It is difficult. It's always challenging, and different children at different ages require different messages. Yeah. They realise mummy's ill and having treatment, obviously, but they don't understand the significance of it. How much should you tell them of the significance? And I think, at the age they are, Kate's children, you probably wouldn't talk about the significance of it. You just say she's being treated and everything's going to be okay. And it probably will be. That's the great thing about it. It's always difficult to know what to say to children. Yeah.
Well, tomorrow feels like a step in the right direction, does it not? Thank you so much for your time on a Friday night, cancer specialist and all-round amazing Dr. Karol Sikora there. Thank you so much for joining us on GB News.